Hello everyone, welcome to another topic in the cellular biochemistry, and in this lecture we are going to read another disorder that occurs due to faulty collagen synthesis, that is Ehlers-Danlos syndrome. Ehlers-Danlos syndrome. So the Ehlers-Danlos syndrome, there is faulty collagen synthesis that results to the various disorders. There are mainly two types of the syndrome, that are the classical type and another is the vascular type. In the classical type, there is only manifestation in the joint and skin, whereas in the vascular type there is manifestation in the various tissue include vessels. Now let us discuss the classical type. As I have already said that in the classical type there is involvement of the joint and skin, and in the classical type there is type 5 collagen mutation, that is COL5A1 and COL5A2 mutation. And in the vascular type there is the type 3 procollagen mutation COL3A1, and which leads to the fragile tissue including the vessels. This syndrome could be autosomal recessive or autosomal dominant. Both from the both type it can inherited in the offspring. Later I will discuss in the genetic chapter detail about the autosomal dominant, autosomal recessive, X-linked disorders. Now you should know that it could be both autosomal recessive and autosomal dominant. Now what is the presentation? What is the presentation? How the Ehlers-Danlos syndrome presents? If there is the classical type of the syndrome, that is defect in the COL5A1 and COL5A2, that means collagen 5A1 and collagen 5A2, then there will be hyperextensible skins, hypermobile joints, and there could be the presentation like joint dislocation. And if this syndrome is vascular, there is higher tendency to bleed. Because the tissue is fragile and vessels are also fragile, which leads to the berry and aortic aneurysm. And there could be also the organ ruptures. For example, gravid uterus can rupture easily if there is vascular type of syndrome. Now in the gravid woman suffering from this Ehlers-Danlos syndrome vascular type, then she is more prone to uterus rupture. And also the people who have vascular type of the disease, then they have more chance of aortic and berry aneurysm, which can rupture easily. Now this all you should know in the Ehlers-Danlos syndrome. Thank you.